Hi everyone, my name is Haley and this is Truth and Fertility. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either avoid or achieve pregnancy, but also just to maintain and manage their own fertility. And I've been doing this now for kind of on and off in different capacities with different methods of charting for about 6 years now. And recently I had somebody ask me, why do you do this? Like, what is your passion? What is the main thing that is driving you to have this passion about what you do, and why do you do it? And the first thing that came to my mind is what I answered. And I said, because I want to get women off the birth control pill. Point blank. Like, if anything else, this is what I want to do. This is what I hope to do. And I have a very strong reason as to why. Well, there's a lot of reasons as to why. But my reason comes from a personal experience with this. I've done a whole video just kind of really walking through my journey with all of this. So I'll link that below if you want to check that out. But just as a very short, in general, of what happened, when I was 16, I went to a doctor because my cycles were not regular, which to me was like, okay, that means there's something wrong. My body's telling me there's probably something wrong. And so I go to the doctor. Without any tests, without any questions, I get put on the birth control pill. Because that's just what happens when a 16-year-old, or however old you are, when you go to the doctor and you say, I have irregular cycles, or you say, I have acne, or you say, I have painful periods, or you say X, Y, or Z, right? The pill is the one magical medicine that's going to make it all better. So I was on the pill for about 2 months, made me super moody. And so I was just over it. I stopped it and didn't really do anything else about my cycles until about 2 years later when I was 18 or 19 years old. And by this point, I knew there was something still wrong. My body, because I was irregular with my cycles, my body was still telling me there was a problem. But I knew I didn't want the birth control pill because of the way that it made me feel when I was on it. And I also knew enough at this point to say, okay, when you have irregular cycles, it means that you're not ovulating regularly. And if we can just take a step back for a second, ovulation is when an egg is released from your ovary, and that should be happening once per cycle. And the average cycle needs to be anywhere between about 24 to 35 days. That's about average for any woman's, in general, any woman's cycle. And so if you're not ovulating on this regular basis, that means there is something wrong with the reproductive system that needs to be fixed. It needs to be addressed, needs to be healed. And so anyways, I knew at this point, I knew enough to say, I didn't want the pill because the primary function of the pill is to suppress ovulation. No matter what the reason you are taking it for, it is suppressing your ovulation. That is the first, basically the first act that it does on the body. And so anyways, I knew enough to know that I didn't want the pill because I knew I needed to ovulate. That's what a healthy reproductive system does. So I went back to the doctor, and I remember her asking me, can I ask you just why you don't want to be on the pill? It's a very, very kind way of asking it, no problem. And I just said, well, I don't ovulate. And I want to ovulate because that's a sign of a healthy body, right? So can you help me to ovulate? And I remember her looking at me and just being like, well, why do you want to ovulate? And in that moment, I had to just sit back. And again, I'm like 18 or 19 years old. I really don't know a whole lot at this point, but it really just showed me a glimpse of the way that our culture, our med students, our culture is taught about the women's reproductive system. And that apparently, until you need to start or want to start having children, it doesn't need to be healthy. Can we just take a step back and and just think about that with logic for a second? Like, why would it be the case that we would say, no, your reproductive system doesn't need to be healthy as if you're 18, not sexually active, you're not using it to avoid pregnancy, like, no, you're fine. Well, that makes no sense, right? With every other part of the body and any other type of medicine, No matter how old you are, if something isn't working right or correctly, the doctor is there to heal that and treat that as best as they can. But for some reason, when we're talking about the women's reproductive cycle, it's like, well, unless you're trying to get pregnant, who cares how healthy you are? It just gave me this glimpse of where we are at right now. And so that is what really started my journey in learning about, okay, charting a woman's cycle. When you chart your cycle as a woman, you are charting different biomarkers or signs that your body is giving you that tell you your hormone imbalances, or that they're rightly balanced. That it tells you so much about your health. And this is where really we can start with good medicine. How do we start with good medicine is to learn how our bodies are working, whether it's properly or improperly. And if it is working improperly, let's say we chart your cycle and then we see something off on your chart. Okay, let's do blood work. Let's do ultrasound. Let's figure out what is going on here to try to heal the root instead of just masking everything or putting a band-aid on it with the pill. So I ended up going to a different OBGYN to get a second opinion. And this OBGYN that I went to was is a kind of special type of OBGYN. It's one that actually doesn't prescribe the birth control pill or any hormonal contraceptives for medicine or even for contraceptive, but for medical purposes as well. What this doctor does is she actually refers you to somebody to learn how to chart your cycle, bring that chart back to her at your follow-up or appointment, and she can look at a chart, and from those biomarkers or different signs that your body is giving you, we can actually read hormonal levels on that chart. It is amazing what that alone can tell us about the woman's body and how it is behaving. And so I started charting my cycle. I did some blood tests, I did some ultrasound, and lo and behold, they were able to find that I have a reproductive disorder called polycystic ovarian syndrome, which is also known as PCOS. And this is kind of becoming more of what I'm seeing lately. Actually, now full circle, I now work at that OBGYN clinic where I am the one teaching these clients how to chart their cycles so that they can bring their charts to the doctor. And it is just a beautiful way that I can kind of give back to that clinic and just to the blessing in my life of being able to heal that even as a single woman, so that when I did get married and I did want to start having children, we were able to do so. So really, that is what provoked this passion in me. And this is why I do this for a living. This is why I want to teach women and couples the better option, that the pill is not actually helping whatever they're on it for, but it's actually hindering what they're on it for. To kind of take a step back again for a second, let's very quickly talk about how a woman's body should naturally be progressing through her reproductive cycle and what the pill actually does to inhibit that. So there's two main reproductive sex hormones for the women, and it's estrogen and progesterone. And these hormones actually should be taking turns throughout the cycle being dominant. So in the first part of the cycle, pre-ovulation, so before a woman ovulates from day one of her period until ovulation, this is the pre-ovulatory phase. Estrogen should be the main player in this phase. Progesterone is very low. And estrogen is the hormone that is responsible for producing cervical mucus. If this is your first time watching a video of mine, you should probably get used to the fact that I'm just going to talk about cervical mucus a lot in these videos. And if you're returning, well, you're just aware of that now. But estrogen is responsible for telling the cervix to produce cervical mucus. And this is vital for your reproductive health. I have another video all on that I'll link below as well. But estrogen is the main player in that pre-ovulation phase. Now, post-ovulation, so once a woman ovulates while she's waiting for her next period to come, it's usually about a two-week period of time before her next menses shows up. And in this post-ovulation phase, progesterone is the main player. And progesterone does the opposite effect. If estrogen kind of allows everything to flow, progesterone drives everything up. And so these hormones are ebbing and flowing throughout the cycle and should be ebbing and flowing in a timely manner every single cycle. And there should be an ovulatory event or ovulation happening in the middle of that, in between that. That is once again, I say very general idea of how the woman's cycle should be. Now, when she is on the pill, what's happening, it also kind of depends on what type of pill, or this, I say pill, but really just any sort of hormonal contraceptive, where it's Mirena IUD has hormones in it that will also do these things, Depo-Provera shot, Nexplanon implant, any type of hormonal contraception, this is what it's going to do. So it has progesterone. Well, actually, scratch that. It has progestin, which is a synthetic version of progesterone, usually in it. And then sometimes those contraceptives those hormonal contraceptives also have a synthetic estrogen in them as well. And so when you're taking this on a daily basis, or if these synthetic hormones, let me remind you, are being kind of pushed into your body through whatever device you may have on a daily and regular basis, what's happening is that you're missing that natural ebb and flow that should be happening. Everything is just elevated with synthetic versions of the hormones, not the true bioidentical hormones that your body creates. Synthetic hormones of progestin and synthetic estrogen are being introduced to the body as long as you're taking that hormonal contraceptives. And even after you take the IUD out or the Nexplanon implant out, or you stop taking the pill, it's not like all of a sudden you're not affected by those anymore. It takes a while for those synthetic hormones to be flushed out. And so with that being said, it's creating this false cycle. It's actually reducing the cycle. You're not even cycling at that point. A lot of women who, especially are taking the pill, oftentimes they'll have 21 days of the pill with these synthetic hormones and then 7 days of a sugar pill or a placebo pill, or they just don't take anything for 7 days to get the kind of what masks as a period. They start to bleed for about a week. But it's not a true period. A true period must follow ovulation. If ovulation is not occurring, and remember what I said at the beginning of this video, any hormonal contraceptive, its first method is going to be to suppress ovulation. So if ovulation is not occurring, a true period is not occurring. So the bleeding episodes that a woman has when she's on a hormonal contraceptive is really just because of either breakthrough bleeding when there shouldn't be bleeding, or it's just withdrawal bleeding from stopping the medication for 7 days. That's pretty much it. And so what we are doing, what the doctors are doing when they prescribe the pill, is they're shutting the reproductive system down. They're telling the ovaries to not do the job that they were designed to do. The ovaries were designed to house the woman's eggs, to release an egg in every cycle at ovulation, and to produce estrogen and progesterone. When you introduce a hormonal contraceptive, what you are doing is you are shutting those ovaries down. You are pumping synthetic versions of those hormones into your body, and you are no longer ovulating. You're no longer producing that cervical mucus, which again, talked about how important that is to a woman's the health of a woman's reproductive cycle. You're no longer producing much of that mucus anymore. And there are plenty of other things that it also does to your body that I'm not going to list off here. If you have a pill packet at home, take a look at the side effects as well of that pill packet, or any hormonal contraceptive. Again, just look at the side effects as well of placing these synthetic versions of these hormones into your body and shutting your whole reproductive system down. Why are so many women being put on the pill for whatever reason? Again, no matter what reason it is, especially at young ages. I mean, I'm against the pill at any age for these reasons, but especially for these young women whose cycles may still just be kind of in practice mode. They may not have even entered into a really mature phase of their cycles. So why are we being put on this pill, on this medication, if all it's doing is shutting the reproductive system down? It's not actually fixing the root cause. It's not, many doctors won't even do any testing, blood work, ultrasound. They don't do anything before they put you on this medication. Any other medication, you're probably getting a blood test to see the hormone levels in your body before they give you the medication to decide what dose you need, or even if you need the medication at all, right? I'll just tell you in my experience, I did not have blood work done before I was put on the pill or prescribed the pill when I was 16. And I have a feeling that most women are not. There's just something different about this pill. There is something different in the way that we've been trained to think about it. And so going back to the beginning of this video, when I was asked recently, what is pushing you? Where is your passion coming from? Why do you spend so much time doing this and teaching women about charting their cycle? It's to get them off the pill. It's to give them a better option and to actually find true healing rather than masking their symptoms or making their symptoms worse. Many women that I talk to in the clinic, they're at that clinic because they want a different option. They've been put on the pill before and they felt just different. They didn't feel themselves. I hear this all the time, how women do not feel like themselves when they are put on the pill or any hormonal contraceptive for that matter. They don't feel like themselves. There's a reason for that. Now, before I end this video, I do want to give you some further resources. This video definitely did not go into nitty-gritty of how the pill works, how the women's reproductive system is supposed to work, right? I have more videos on that, but if you want more resources as well, I have a book to recommend to you. It's called This Is Your Brain on Birth Control. It is by Dr. Sarah E. Hill. I read this quite a while ago. So my goal is to read through this again very soon and kind of do more videos describing what she is talking about. So basically she does exactly what I would hope to do is walking through how the women's reproductive cycle should be in a healthy circumstance and what the pill is actually doing to your brain and how that moves into your body, because your brain is, the powerhouse of everything else. So I highly recommend this book. My only critique of this book, not any of the factual information she has in here, this is all great. My only critique is that at the very end, she's a little loose in the way that she says, here's all the bad things about the pill, but if it's the only option that you have, then go for it. Whereas I would say there is always another option. There's always another option. So that's my only critique. But everything else is amazing in this book. She also writes in a really funny way. Like I found myself actually laughing out loud while reading this book at some points. And it is a perfect book for the layperson, so a non-medical person, to read and understand. It's very helpful to have more information. So grab this book. I'm sure it's on Amazon. I can link it below as well. And I hope this video was helpful in just describing why the pill is bad medicine, why there's a better option, and how to get that better option. I'll leave some links below as well to find doctors in your area that do things that practice medicine in the way that the doctor I work for now does, and that they will look at your chart. They'll teach you how to chart first. They'll look at your fertility chart and make decisions and do testing and heal you based on that, looking at the root cause of what's going on rather than placing a Band-Aid and shutting that reproductive system all the way down. You deserve better than that. You deserve to be more educated than that. So that's my goal. Please go ahead and subscribe and like this video if you learned something or if you found it helpful to you. That helps me a lot as well to be able to continue these videos. And I will see you again next week.